people.
Okay.
And here we go.
Okay.
Welcome, welcome, welcome in, everyone. Welcome to Care Concierge with Care Patrol. We're so happy to have you in today. It's a gray day here. I hope the sun is shining on you wherever you are, at least metaphorically. Those of you who are new to us, we are Care Patrol. We are a referral and placement agency working with aging adults and their loved ones to find appropriate care options at this stage in their lives. And we do so at no charge to our clients, just as we provide these contact hours at no charge to you. We are accredited by the Alabama Board of Nursing Practitioners, and we're also accredited by the Alabama Board of Social Work Examiners. And each one of them tell us that this hour is worth 1.0 contact hour for social work and for nursing. Nurses, we will place your hours for you on the ABN website. Everyone who will get a certificate who does the evaluation, you must do the evaluation to get credit. The evaluation is online and it's password protected. We give the password at the end. And by doing this, the Board of Social Work tell us that we can advertise this hour as a live hour or a classroom hour. So this is a live hour, although it is on the internet. The online evaluation, I will read to you. I know that some of you are in your car or at your desk or not seeing the screen. I'll post this in the room as well. The evaluation link today, if you're ready, if you have a pen or some way to make note, is https colon forward slash forward slash www.surveymonkey.com forward slash lowercase r forward slash all uppercase letters with numbers 6K as in kite, 5S as in Sam, L as in Leslie, C as in cat, Q. I did, Miss C, paste the link in the chat. If you don't see it, let me paste it again. So you must do the evaluation to receive credit, and that will be available to you at the end when we give the password. We're so pleased today to be joined by the now director of the Area Agency on Aging with United Way of Jefferson County, which manages the Area Agency on Aging. And Ashley Lemsky is so kind as to give her time today to tell us all of the various programs and resources that they offer aging folks in our area and across all areas. It's consistent in terms of being area agencies on aging across the state. Ashley can tell us more. Thank you so much, Ashley, for being here. And please correct me if I'm said anything wrong.
Nope, you did a great job, Sean. Thank you. I'm glad to be here. Sean and I met a long time ago, I say a couple of months ago. So he had asked me to come and do a presentation for y'all about our services and programs. So I'm happy to talk about the Area Agency on Aging and tell y'all a little bit about the services that we provide. So, okay, we'll go ahead and get started. Okay, so United Way Area Agency on Aging is one of 13 area agencies on aging in the state of Alabama. So our area agency only covers Jefferson County, and Jefferson County serves a wide population. That's why we only service Jefferson County. However, in Alabama, there are, like I said, 13 area agencies on aging in the state, and they may cover multiple counties. So I know I used to work at the Middle Alabama Area Agency on Aging, and we serviced 5 counties. So, and that was Blount, Chilton, Shelby, St. Clair, and Walker. Those are the counties that around Jefferson County. So there are area agencies that service more than one county, depending on the population. And so we are funded through the Alabama Department of Senior Services. We receive federal and state funding. We also receive local funds. However, most of our funding is federal and state. Also, too, we serve those that are elderly and those that are disabled, and all of our services are free. When I say free, they don't cost anything. You can make a donation. However, they are free to someone that is interested in getting these services. Also, we service those that are disabled. However, I will say a lot more of our services are for the elderly, and we will go through those now. And this just gives you an idea of our year-to-date numbers, of where we stand, how many meals we've served at senior centers, the total number of seniors we've served from October to June, and then also how many calls that we have had, and then referrals that we've made on behalf of seniors, Medicare counseling, prescription assistance. And so you'll hear a little bit more about all of these services, our respite hours, legal services, and everything. So when somebody, to get to our services, 1-800-AGE line, 1-800-243-5463. That is the number that you can call from anywhere in the state of Alabama, and it's supposed to connect you to that area agency within the county that you're calling. Sometimes they don't always do that, but that's the main purpose of that line, and that's what most people call to get our services. Okay, let's talk about the Aging and Disability Resource Center. The Aging and Disability Resource Center is also referred to the ADRC. So if you hear me refer to that, that is what I'm speaking about. So the Aging and Disability Resource Center is the no wrong door approach. And what that means is it's designed for all callers to go through the Area Agency on Aging's ADRC. And so what they do is they begin the assessment process. When someone calls in, they will go through and they will get their demographic information. They will get their income information. They will ask them questions about their insurance. They will screen them and do a whole assessment process, kind of like a benefits checkup. They may call in for one service, but they are going to get several services, even if they say, you know what, I only need prescription assistance, but we may find out they're a caregiver, or we may find out they qualify for Medicare savings programs. So when we screen them and do our assessment, it is for all of our programs and services, plus it may be for some resources that we have in the community that we can give them. So most of the time people are calling in to the age line. Most of the time they are not going to be walking in our front door because we are in downtown Birmingham. So there's not many people that want to drive in downtown Birmingham, especially seniors, to get to our office. So most of our clients are those that call. We do have people that do walk in, like I said, and then we have referrals that are made by caregivers, or they're actually made by social workers or providers in the healthcare realm. And so we do get a lot of referrals from those social workers, that may be discharge planners or anything. And so we assess them as well when they provide their information about the client. So our population we serve, like I said, is 55. It actually is 55 years of age and older. Any individual with disabilities, whether it's physical, intellectual, or developmental, and then their caregivers and their families. Also, too, when someone calls our office, it takes about 45 minutes to go through the assessment process, only because we are making sure that we are screening them for everything. And then we will go from there to refer them to the services they need to go to. Also, too, when someone calls the ADRC, we give them person-centered care. What that means is all of our specialists are trained to make sure that they are assessing the person, and make sure that they are understanding their needs and their wants and everything that is needed to assist them and give them the guidance they need. So when we refer them to the following programs, it may be any of our AAA programs that I'm going to talk about. It may be Medicaid waiver, and I'll tell you a little bit about that in just a second. It may be SNAP or ASAP, food assistance, farmers market vouchers, and then those community resources that are out there. Financial assistance, maybe sitter or companion services, food assistance. So our ADRC specialist, we have 3 ADRC specialists and 1 coordinator. They are knowledgeable about everything when it comes to the community, since they are on the front lines when people call. And we have an advantage because we are with the United Way, and we have the 211 call center that's located next to our area agency. So we actually kind of partner with them when it comes to programs and everything to see with resources and getting the needs that we need assessed. If we can't find a resource for that, we can rely on 211 to help. And this is a great partnership. And our area agency joined United Way back in 2016. So after 40 years of it being with Jefferson County, United Way placed a bid on our services so we could have those services here. And it's been a great partnership since. So we're coming up on 10-year anniversary next year. Okay, a little bit about the most requested needs in the ADRC. Transportation for sure. If you are from Birmingham, you know that transportation is not the greatest in the city. We have, it's either Class Tran. You have people that are needing to go for transportation to and from the doctor's office. And you have to call ahead to get those appointments. And sometimes you just need to go to the pharmacy or the grocery store. So transportation is a huge need for resources. Next is housing. We know that housing, there are some the developments beginning or they are coming with housing. And so I know that these housing needs are still needing or beginning to be addressed. And I also know that there are still continuing housing needs, whether it's just senior high-rise facilities or housing in general for those that are low income. Utility and rental assistance is always something that we get. Even though we do not provide that, we can provide those resources out in the community for that. And then food assistance is actually one of those that has been requested recently. And it's just because the food, when you go to the grocery store, the rise in prices has really affected those seniors. And then home repairs. That is another one that seniors just can't repair their home needs, or may have a leaky roof, or different things. And so those needs are the main needs that we address when it comes to our assessments, and those needing community resources. External referrals, let's talk about those. So we are one of the area agencies on aging that does not have the Medicaid waiver program. All of the state of Alabama has Medicaid waiver programs within the area agency. However, us being different, the Medicaid waiver program is located through the Regional Planning Commission of Greater Birmingham. They do an awesome job. We partner with them. We send referrals to them when it comes to the elderly and disabled waiver program. And what that program does is they are there to provide services for those that meet skilled nursing level of care. So most people cannot afford to go to a nursing home, considering it's $8,000 to $10,000 monthly. And so therefore they have the Medicaid waiver program, which is case managers that assess the individuals that are needing this placement or that are needing care monthly at their home and try to provide those services that they would get in a nursing facility at their home. Of course, these people have to be at risk for going into a nursing home. And then also too, they are going to look at their income, and they're going to look at their resources, whether it's assets like stocks and bonds or any other resources. So they do look at that. Then another program with the elderly and disabled waiver program is the personal choices program. Someone that is needing or would like to actually name their caregiver, or they say, hey, I would like my daughter to care for me since she had to quit her job and care for and is caring for me now. The personal choices program within Medicaid waiver allows you to do that. And so that is something that is, I would say, it's a newer program, and that allows a little bit more choice of who the care is coming from. Also, for food assistance, we help our ADRC specialists help those that are calling in fill out an application for food assistance. The application is for those that either are 60 years of age or older. We can help them fill out the simplified application. We look at their, we try to help them fill out as much as we can, and then we will send in the application for them to put their signature on, and then also put the requested documents on. So any kind of applications, we help them complete those with our Aging and Disability Resource Center. And that's why the phone call may take a little bit longer than just an average, 20, 30 minutes or so. It may take 45 minutes to an hour if we're helping with an application. This just tells you a little bit about the SNAP food assistance and the eligibility requirements for that. And then it also tells you the basic requirements. Of course, live in Alabama, be a U.S. citizen or qualified legal resident, and then the household size and the income requirements. So we look at that every time when we are assessing someone when they call in and they may be in needing food assistance. And if they don't meet the SNAP food assistance, we actually give them food resources, food pantries, or either there's also food car lines at churches that are held with Grace Klein that does stuff like that. So we always provide them with resources for that. This is more about the SNAP food program and the eligibility requirements for this. And then other referrals that we make in the community, as you can see, Positive Maturity, they have a companion service. So and it's a free service for them, or it's a free service for callers and clients that qualify. So we refer them to there if they need someone that is a companion. Oasis program, they help those that are legally blind, and they help them with daily living, whether it's putting labels on different things to help them understand how to use the microwave or the stove. Alzheimer's of Central Alabama, a great resource. Collat Jewish Family Services as well. Disability Rights and Resources, and then we have our senior talk line through the Crisis Center that offer volunteer phone calls weekly for those seniors that may be feeling isolated or lonely. Okay, let's talk about the Alabama Cares program. So our Alabama Cares program is a program for those to support the caregiver. So when I say this program supports the caregiver, they are 100% wanting that caregiver to not experience burnout. My mom takes care of my dad. My mom is 78 and my dad is 82, and my dad has dementia. So when I say Alabama Cares supports caregivers, we don't use this program, I will say, but it is so needed because I see that the need for those caregivers that are burnout, because that is something my mom is on the verge of burnout. Also too, they offer support groups. So they offer so many things that I feel like a caregiver can just, utilize and just feel supported. Information on community resources, for example, help in assessing the caregiver needs and services. Like, hey, I found a service, where can I go or what can I do? Just assistance in those in short-term case management. Monthly support groups. We have those every month, and they're usually on Tuesdays. Our support groups, they used to be like 10, 12. They're over 20 people in those support groups now. We have had a lot of people just come to those support groups. And then one of the success stories I will tell you about these support groups is we had a lady, her mother passed away just recently, and she said, I don't want to stop coming to this support group. Do I have to stop coming to this support group? And we were like, no, you don't. And so she actually wants to stay and help with the support group and help support those that are in the support group that may experience grief. So that just tells you how involved this support group has been and how of a friendship and support system it is. We offer temporary respite services for those that are caregivers when you need to go to the doctor, to the hospital, or go out for groceries. That is something that is huge. I know my mom gives me her grocery list and I go and get her groceries for her. Or if she can step away while my dad's receiving any kind of treatment, a doctor's appointment or IV or whatever, she will run to the grocery store. So that little time is so precious to caregivers. Counseling and guidance to help make decisions and solve problems. There's so many times that thankfully I'm in a role that I am that I can help my mom say, well, do you think dad needs to go into a nursing facility? What are you going to do at this time? Or what about this? So I'm glad that I can help her with some of those issues, but some people don't have that. So Alabama Cares has been a great resource for that. Training to improve family caregivers' knowledge, and then supplemental products and services. Those can be like Glucerna, Ensure, bed pads, the pull-ups. So all of those are through the Alabama Cares program that support the caregivers. The eligibility for that is, of course, an individual must have a caregiver. We have social workers that will send in referrals, but there's no caregiver. So we don't supply that caregiver, but we will offer these services for a caregiver. The caregiver must provide 20 hours of service of care weekly. That's easily done. Also, two primary caregivers of frail older adults that are 60 plus, and then a primary caregiver of a person of Alzheimer's disease or dementia may be served regardless of the person with dementia, their age. And then there are no income restrictions. However, those with the greatest social and economic needs usually receive priority. Next, a part of the Alabama Cares program is the Older Relative Caregiver Program. The Older Relative Caregiver Program is to help ease the strain of raising children or raising grandchildren through case management, support groups as well, and then temporary financial assistance. We do have a caregiver support group for the older relative caregivers that meets as well on Tuesdays. And then also too, we have any type of financial assistance. That financial assistance may be back to school supplies. We just had a lot of orders for back to school supplies that we've helped these older relatives with. Also, their respite care looks a little bit different. And when I say that, it's not leave your kid so the mom, so like the caregiver is not going to the grocery store or anything like that, but it's the the caregiver getting some respite with after school care, or it may be child care, or it may be a summer program. Also, it may just be the financial support for a tutoring program. But there's two options when it comes to the older relative caregiver program. The caregivers must be 55 years of age or older and providing care for an adult child 19 to 59 who is permanently disabled, or caring for a minor child. Caregiver must be 55 years of age or older, and then the child must live with them that's under 18 and reside in Jefferson County. Okay, so moving along under Alabama Cares, this is also a program, and it's homemaker and personal care services. However, this is not really about the caregiver. It's on the other side of someone. This is for homemaker and personal care services for someone living alone, someone that must be 60 years of age or older and live alone, and then they have to meet two activities of daily living, and need two of the following services. So, any type of light housekeeping, such as dusting, vacuuming, changing bed linens, laundry, light meal preparation. And then the personal care includes bathing assistance, dressing or grooming assistance, toileting, feeding, ambulation, and then medication reminders. But for someone, like I said, to qualify, they have to be 60 years of age or older. They have to live in Jefferson County, and then they have to live alone and need help, like I said, with a minimum of two activities of daily living. So this would qualify for, someone that just needs assistance. Maybe they are living in a high-rise apartment in Birmingham, and they, can't take out their trash on as often as they need to. Or it may be that they just need help with simple meal preparation. So we can definitely help with some of those things as well. Okay, let's talk about our senior nutrition program. Our senior nutrition program is our senior centers. We have 27 senior centers in the Jefferson County area. The one in the picture is Hoover Senior Center. They are a very active senior center. You do have seniors that are not as active. For example, I will say Hueytown Senior Center. I live close to Hueytown. Hueytown Senior Center is not as active. They are usually drinking coffee or maybe watching the news or playing bingo when I come. Whereas you have Hoover Senior Center, they have line dancing going on. They have someone coming in to do it may be presentations for financial stability, or they just have a lot going. They have an exercise class. You have Trustful Senior Center. They did a tour to Atlanta and went to the aquarium and the Coke Museum and several places. So you have different senior centers, and it's going to depend on the people that live in that area. The senior centers are great though, because what they do is they provide the hot meal, which is free of charge. Trio actually is who we're contracted with. So everyone in the state of Alabama that goes to a senior center receives a meal that's free of charge and hot. Also, too, the senior centers allow healthy social interaction, so access to numerous resources and activities like we talked about. And then we provide nutrition counseling. So someone that might be just newly diagnosed with diabetes or have a chronic medical condition that may be new to them, we can provide them one-on-one nutrition counseling as long as they have a doctor's approval. We usually provide them with about an hour of nutrition counseling, and then we follow up to see if any other time is needed after that. We have registered dietitians that help with nutrition goals, and then also to preventive health in those senior centers. Not all of our senior centers have Tai Chi or Walk with Ease, but those are the two programs that we offer at the senior centers. Also, for to go to the senior center, you have to be 60 years of age or older. And then some senior centers provide transportation, but that is going to be through the city. So not all senior centers have transportation. It just kind of depends on what the city provides for them. Next, this may be a little bit harder to see, but this is a listing of all of the senior center nutrition sites in Jefferson County. You will also see on the very end of the first column, Meals on Wheels. We have out of United Way, our office, we have a Meals on Wheels site, and people come and pick up they come and pick up meals. So we consider this in with one of our pickup sites. And then Irondale, which is about from our office, I'd say maybe 15 minutes from our office, is the newest senior center that we just opened, but we have 27 total in Jefferson County. And those senior centers, I will say, have hot meals that come out of those senior centers. So you have those in the congregate setting that's eating a meal at the senior center, but then there's also meals that go out from the senior centers as well, and they have volunteers to run that route. Which brings me to Meals on Wheels, is a program that most of you have probably heard of. Meals on Wheels, I would say, is one that when we first got the Area Agency on Aging, we had a lot of advertisement around the Meals on Wheels program. And so, like I said, most of you have probably heard about the Meals on Wheels program. So with Meals on Wheels, seniors who are homebound and isolated and do not have access to transportation may qualify for the homebound meals free of charge. This does depend on the location, because if they are not located near a senior center or a route, volunteers may not be able to get them a hot meal or a frozen pack of meals. Meals on Wheels depends on volunteers to deliver those meals. So we definitely cannot do Meals on Wheels with our, let's say, maybe 10 to 12 people in the Meals on Wheels program. And we do rely on those volunteers, whether it is a company, whether it's a church, or whether it's an individual that decides, they want to deliver those meals. The meals are usually delivered around lunchtime. It takes about an hour and a half at the most to deliver those meals. But those people that qualify for the meals have to be 60 years of age or older, be homebound due to an illness or incapacitating disability, unable to prepare a meal lunchtime, and then like I said, the no meal preparation at lunchtime. And then some people may say, you know what, I just don't want my grandmother preparing a meal. She leaves the stove on. So that might be a reason why somebody would need Meals on Wheels. Also, too, with the Meals on Wheels program, they are either getting a frozen pack of 5 meals or 7 meals. It just depends on the area they live in, or they're getting a hot meal. So you have different routes that receive different types of meals. Okay, let's talk about Legal Services. Legal Services of Alabama is who the Area Agency on Aging contracts with. So when someone calls our office, the 1-800-AGE line, we will actually send a referral over to Legal Services of Alabama. Our Legal Services of Alabama is the program that assists seniors by helping them understand their rights, exercise choice, and meet essential needs of income, shelter, healthcare, and nutrition. So the people that are eligible for our legal services are those that are 60 years of age or older. And one of the things that is required, they cannot have anyone go to court to represent them. So most of our legal attorneys work on wills, power of attorneys, advanced directives, QIT, so they can qualify for Medicaid, a qualifying income trust. They help with eviction notices. They help with any type of legal paperwork. So those attorneys work off of a grant that they receive just to help with these kind of things for those. individuals, and these services are free. So therefore, they do not have to pay for these services at all. Okay. Let's talk about our long-term care ombudsman program. Our long-term care ombudsman program is a program for those that are in long-term care facilities, such as nursing homes, assisted living, and we also go to the boarding homes. But what the ombudsman do is they are there for the families to help them, just when you have a loved one in a nursing home, just to help support those families and let those residents understand their rights. I know when my dad had to go into do some physical therapy at one of the nursing facilities, it was so different. For my mom, my sister, me, it was so, having those long-term care ombudsmen there for families when their loved one goes into a facility is really helpful, but it's also helpful for the residents. The residents may wonder, hey, can I still get my mail? How much money do I have to spend? Or, they have questions that they still are needing those answers to. So that's how the ombudsmen are available. They are advocates for those residents and their families when matters concerning quality of care. They investigate complaints on behalf of those residents and their families. They monitor the quality of consistency in long-term care, and then they provide in-service trainings to the facility staff. And then, of course, they advocate for policy changes. So they take complaints, whether it is by phone or in person, or that somebody can write to them through email and get and put in a complaint. Also, it can be anonymous. Some people don't like to, put complaints in because they think there's retaliation upon, the nursing home facility workers. And that's not always the case. So these can come in anonymously, or they can come in through a family member, or they can come in by the residents, the complaints can. Not only do they, when they monitor the quality and consistency of long-term care, they are doing friendly visits. So they are going in and they are visiting those facilities, talking to the residents to make sure their quality of care, they understand their rights and everything. And I think that's a little bit about the ombudsman program. We talked about how those complaints can be utilized, or how those complaints can be made, and then anyone can utilize the ombudsman program. There are posters in every facility that has a picture of our ombudsman on there. So most people will find a poster if they are looking for the ombudsman, but they do try to do in services with the families, with the staff when they can. So it's just sometimes the staff and the staff, get busy and they're not able to schedule them for an in service, but they're always up for educating them. And they do offer an online training. It's the fourth Thursday of every month, where staff can log on from long-term care facilities and listen and ask questions to the ombudsman. Okay, moving on, we are talking about the State Health Insurance Assistance Program, which is Medicare counseling. Usually Susan, our coordinator, says, I speak Medicare, and she sure does. So SHIP is Alabama's State Health Insurance Assistance Program. SHIP counselors and volunteers are helping people helping people make informed decisions about their health insurance benefits. They also will not attempt to sell any type of insurance. So therefore, they are wanting to just help them get the information that is needed so they can make a decision about their Medicare, an informed decision, a personalized, unbiased decision. So SHIP is actually a trusted source for about Medicare, about health insurance, because they go through a Medicare SHIP certification boot camp. And so all of our counselors are trained, all of our staff are trained on Medicare, so we can answer questions when it comes to the types of Medicare coverage. And then how can SHIP help? They can help you understand your benefits, again, without giving any type of biased answers. Since they don't work for an insurance company, what they usually do during their busiest time of year and throughout the year, during Medicare open enrollment, October 15th through December 7th, they do plan comparison forms. And what those plan comparison forms tells us is the list of all of the client's medications, and it also says what hospital system you go to. So when we, as a counselor or volunteer, when we enter those medications into the computer system, it pulls up the top 3 plans that are best for them. What those top 3 plans tell them is it tells them, one, are all their medications being covered? Number 2, it tells them the tier level. How much are they going to pay for those medications? If they're on tier 1, or is it a tier 4 or a tier 3? And then it's also going to tell them about, of the cost and everything. And it's also going to tell them if their doctor's offices may be in that system for the insurance that's needed, whether it's a Part D drug plan or a Medicare Advantage plan that's going to cover both health benefits and drug benefits. SHIP can also help determine if they need a prescription or a low-income subsidy. Low-income subsidy is for those that need assistance paying for their medications. Also, Medicare savings programs. If someone in the state of Alabama qualifies for Medicare savings programs, our SHIP program helps them complete an application, sends that to Medicaid, and then once they get the letter of approval, we can help them sit down and go through and find another plan that may have lower copays or lower premiums for them. So SHIP is just wonderful when it comes to helping give that unbiased Medicare assistance. I know some of our senior centers, they rely on brokers to come, and I know that is fine because seniors, because the brokers sell multiple types of insurance. However, with the state health insurance assistance program, we do work with brokers, we do work with insurance companies for them to give us their information. And then if somebody says, hey, I think I'm going to go with so and so plan, we actually give them a local person in the area to call, so they're not having to call a 1-800 number to try to go through and enroll. We actually get them in touch with someone locally. So we do have a good relationship with our insurance companies in the area. Okay, we're going to talk about our Senior Medicare Patrol program as well. Our Senior Medicare Patrol is preventing Medicare fraud. What they want to do is they help empower individuals to protect, detect, and report any healthcare fraud, errors, and abuse. How we do this is S&P helps individuals review their Medicare summary notices. They educate them in groups about scams, and then also advocate local, state, and federal officials to solutions to unfair business practices for Medicare and Medicaid. One of the big things that we do as our area agency, and all the area agencies in the state of Alabama have them, are Medicare fraud summits. And so what we usually, these are held in May, and we have someone from the Alabama Securities Commission. We have someone from the FBI come. We may have someone from a pharmacy talk about scams. We may have somebody talk about trying to think what we've had, real estate fraud. So we have a big summit that we put on each May. We have vendors that come and they have additional information for those seniors to give them resources. And then we have speakers, and it usually starts at 9 and it goes to about 1 or 2. And so that is our big thing that we have that promotes the Senior Medicare Patrol program. And then Susan, which is also the SHIP coordinator, she is the one that goes out and does those presentations for seniors, talking about fraud and scams as well. Okay, so the next program is Senior RX. So, Senior RX is a statewide program that helps individuals receive free or reduced costing medications or prescription drugs. And this is to help manage a diagnosed chronic medical conditions. Senior X has helped thousands in the state of Alabama receive these drugs or these prescription drugs. And what it does is if someone is 55 years of age or older and they have a chronic medical condition, but they don't have any prescription insurance coverage, we can help them. We do not have income requirements when it comes to the program within our agency. So what we do is we apply directly to those pharmaceutical companies, and those pharmaceutical companies have income requirements that we base our income requirements on. So it can be different for every prescription that is filled. And so those prescription drug companies, they make the income requirements, and we go by those. So those that are 55, and if you do have insurance and you say, hey, my insurance is not covering my prescription drug, we can help with that as well. Or if it may be that this year's changed a little bit with Medicare, how you have to actually meet your deductible first, and then that's when Medicare will start paying a little bit. And so some people were having trouble meeting that deductible. I know my mom went to get one of her medications. She was like, it's gonna be $500. I was like, $500? And she was like, yeah, I haven't met my deductible yet. But hearing that at the first of the year is just something that she was not expecting to hear when all of her medications had been $10, $15, $20. So that is a hardship when it comes to seniors because they're living off of a social security check, or they may have a little bit of retirement. So they're not wanting to spend that on medications, or they have to choose that between food or medications. So we can help with that as well. And any individual that's in the disability waiting period. Most people that are applying for disability don't have insurance during that disability waiting period, and it takes about 2 years to get that. So we can help them with medications as well. So what we do is we apply directly to that pharmaceutical company, and we can get a 90-day supply of brand name medications for free or at a reduced cost for that. And then someone can stay on this program as long as they need it. So it's not you get a 3-month prescription and then you're done. No, we send out reminder cards every month. And so it tells you, hey, you are up for your 90-day supply refill. And so they can stay on this as long as they need to. And then, of course, it reduces any kind of affordable medication, of course, reduces the risk of going into the ER for visits, going into the hospital or nursing home placement. So Senior X is just there to help with those needs to get those medications and make those more available. We do not see the medications come through our office. We don't see any type of money that comes through our office. What it is it's shipped directly to the client's home, and they work out everything with the pharmaceutical company. We just help make it available for them and help complete the paperwork and get it to the doctor's office and everything that's needed so they can get these medications. And it don't take as much time and effort for them to do that. And then this is my last slide, and this is talking about where the other area agencies on aging in the state of Alabama is. If you go to the Alabama Department of Senior Services and you click on help services, this will take you to a map, and you can actually highlight over the area, and it will tell you over to the side of what that area is. For example, If you highlighted over the WARC, it's going to tell you West Alabama Regional Commission, and it will tell you the address, the phone number, and the website to get in touch with it. So I feel like it is a very useful resource for those that work in the state of Alabama. Also, too, our website is great if you are a social worker and you need to refer clients to us. I see a few names on here that I'm like, I've seen a referral from you before. I've seen one from you before too. And so, if you do need to go to our website and make a referral for any of these services, you can go to uwaaa.org, and there is a place at the top that says referrals, and you will just complete this information form, and then we will actually call that client directly and go ahead and do the assessment process with them. It used to be in the past, it was a little bit more time, I would say, when we would call the social worker after they left a message, and then we would have to call the client. And so it just kind of takes like the middleman out of it. We go from the social worker to the client. And so we go from there to make sure that it's more of a timely response as well, instead of having to contact each person to actually get the information to make the call back. Okay.
That was a lot. That was really interesting. Thank you. We have a couple of questions.
Okay.
One is from Miss C, who asked, and this was early in the presentation, if someone is disabled, do they also need to be 55 years and older?
So the services that we have, I'm sorry, did I interrupt you?
No, go ahead.
Okay. The services that we have for those that are disabled would be mostly the prescription assistance services, just because there's no age limit for that one, especially if they are disabled. Also, too, we have resources that we can give them in the community. Some of these services they may not qualify for because you do have to be 55 or you do have to be 60. But if you are disabled and you're wanting just to call and get an assessment done of what you may qualify for and to get resources out in the community, we can definitely help you with that. So no, not all of them do have to be 55. But I would say the prescription assistance is more of along the lines if you are under 55 of one of, the service we can help you with, plus the community resources we can give.
Well, Miss Loy says the majority of people I talk to are caregivers. So grateful for Alabama Cares and area agencies on aging. It has helped so many of my families. And
Great.
then Miss Josh asked if we email me your slides and I'll share them.
Sure, I'll be glad to.
And Alice Nelson asked, are independent living residents able to utilize ombudsman or only at the assisted level and higher?
Great question. So the independent living residents are not able to utilize the ombudsman only because they are not in the assisted living or the skilled nursing facility or a boarding home. So I've actually worked at one of the facilities in the Birmingham area and did the activities for the independent living facilities. So I know they are a little bit different because they are not under some of the same requirements and guidelines as those in assisted living facilities or the skilled nursing and boarding homes.
Because independent living is unregulated, right? So
Yes,
it wouldn't be
it
subject
is.
to regulation or an ombudsman.
Mhm.
Shelby Canute is asking, what is the current waiting period to start receiving assistance after a referral is placed?
It actually depends on the program. So, for example, if you called in for Alabama Cares, you're not going to go on the list and say, Ashley Lemsky, she called and she went on the list on August 11th. It is going to be based on your need, and it's going to be based on, those activities of daily living. We use those in the assessment tool, and that is how we kind of prioritize where you would need need to go on a wait list if there is a wait list. So it just is, it differs for each program. There's not really I can't say 2, 3 weeks, but we do send the referral the same day. And then it just kind of depends on if, there is a route open, a slot open on the route for Meals on Wheels, or if there is an assessment that can be done, within the next month or so for the respite service. So it depends. It's different for each program.
Beth Green says, excellent presentation, Ashley. My first job out of college was first with Jefferson County AAA, Meals on Wheels, and then Medicaid waiver over
Okay.
40 years ago. I'm curious if your agency receives a considerable number of referrals from hospitals.
We Yes and no. That's kind of I feel like we could receive more, to be honest with you. I do know that we have a lot of referrals from UAB. The social workers send a lot of referrals, but I feel like we need a better connection with the discharge planners, but it's been a little bit harder for that. I will say we have someone joining our advisory council. They have will start coming in November, and she's actually a discharge planner. So I'm hoping that we can strengthen those partnerships with the hospitals and the discharge planners, so they will know that these services are available, because I feel like they could be more known to those that may need it. And I used to actually go up to UAB West in Bessemer, and I used to talk with a man each, probably I would say every quarter, and he'd be like, bring me all that you have, all of your brochures, everything. And so I felt like we had a good connection there, but I actually think he may have moved within the past, I'd say, year or so, and we've lost that connection with them. But yeah, I feel like it could be strengthened, to be honest with you.
She said that makes sense, and she thinks there's a need as well. She'd love to talk with you more about transitions of care. Miss Palkey asked, is there anything for Montgomery County?
Yes, on Montgomery County, you can see it's called a CAC. CAC is the Central Alabama Aging Consortium. And then if you'll just go, if you wanted to Google Central Alabama Aging Consortium, you can, or go to the https alabamaageline.gov, and you can click on that part of the county or that part of the state, and it will give you the information for CAC.
She said they use CAC. Thank you.
Okay, great. Good.
Well, this was excellent. We've had many people say great presentation, and they do want the slides.
Okay.
Oh, here's one from Miss Duncan. Are undocumented people eligible for services?
We ask for a social security number on most everybody so we can provide those services. So, but I know with Senior X, we could provide at one point we could provide services.
That's interesting. And I'm concerned. I'm not concerned. I am concerned about your funding overall, but I guess we'll all wait and see. We're near the end, so I'll give the password. The evaluation link, one more time for those of you who may not have made note of it, is https:// www.surveymonkey.com/lowercase r/ all uppercase letters with numbers 6K5 S as in Sam, L, C as in cat, Q. And the password today is AAA, capital A, capital A, capital A. AAA is the password. And Miss Palkey says, excellent presentation. I agree. The code word is the same as the password for those who are asking. So when you're asked for the code word password, they're the same thing. Triple A. Giving you the evaluation link. Thank you so much, Ms. Lemsky, for being with us today. It was very enlightening and we learned a lot. If you'd like to join us again in 2 weeks on the 25th, we'll be doing breath work and meditation for caregivers. So, any of you that experience stress and want some ways to alleviate that during the day, tune in next week. The passcode, Miss Renfro, is triple A, all caps. AAA, Area Agency on Aging. Thank you so much to Ashley Lemsky, and congratulations to her on being promoted to the director of the AAA for our area. And thank you again. We hope we'll probably ask you to join us again next year, if you will.
Sounds like a plan. Thank you. I appreciate y'all.
Yes. Everyone have a great couple of weeks.